But, my husband often says, you know, um, more is caught than taught, meaning like in these environments that children are in, you can be telling them, don't do this, don't be smoking, don't be, drinking, don't be selling. But if they're seeing it, they're still impacted.
What up, everyone? This is the Spare No Effort podcast. I'm Jeremy Jennings. I am excited to have a very special guest join us on our platform, Miss Theresa Martin Wilson. How are you doing today?
I'm doing wonderful. How about yourself?
I'm doing pretty good. I really wanted to start the episode by giving you a title, and I tried to look at it, give all your accomplishments and everything. And I tried to look at your page before we started, but I didn't want to butcher it. So do you mind just saying what you do? Talk a little bit about your credentials if you don't mind.
Okay. I am technically a Tennessee licensed, board certified family psychiatric mental health nurse practitioner. So, in short, what that means is I'm licensed by the state of Tennessee. I have board certification. I'm able to evaluate patients across the lifespan, regardless of age, for mental health treatment evaluations and make recommendations and provide treatment for individuals.
Okay, okay. And I'm so excited to have you on as someone who has been on their mental health journey for probably about 8 or 9 years now. I can definitely say you've made a big impact in my life. Honestly, if it wasn't for me meeting you, I don't know if I ever would have got on a plane again, truthfully. So I'm really excited to have you on and everything. I'm the type of person, everything that I learn, anything that I learn new or a life hack or whatever, I want to share it with other people. And I really wanted to have you on to share the importance of mental health and just really have a conversation about mental health because I think it's really, really critical in our community. But before that, I want to start off. I'm very big on origin stories, right? So I wanted to talk about, I wanted you to talk about what your upbringing was like. What was key moments in your life that helped shape the person you became today?
Okay. And very much like yourself, I am very transparent. And so I think that one of the things that I've learned just in my profession and in my personal life, is we shouldn't judge books by the cover. We say that as a
Mm-hmm.
cliche, but it's true. So, how I would describe my upbringing, if I was being totally transparent, and I'm going to be, I would describe it as complicated in the sense that my mother married my stepfather. I was one of three kids, meaning my mother had me and my two older brothers. My
Okay.
stepfather, when they got married, he had four children that were much older than us that he
Okay.
had full custody of. So that made seven. And then together they had two. So imagine that, nine children
Mm-hmm.
and just blended in more ways than one. And so, I would describe it now as an adult, especially someone working in mental health, as wow, that was complicated. There was a lot of dynamics there. Um,
Mm-hmm.
During that time of life, I don't know if people were talking about blended families or who guided them, if anybody. But for
Mm-hmm.
me as a child growing up in it, I would say that it was just very complicated. And so at a very early age, without me even knowing why I was doing it, but I definitely searched for coping strategies.
Mm-hmm.
And that led me to to immerse myself into reading, academics, sports,
Mm-hmm.
science fair, you name it, things
Mm-hmm.
that I knew that I would be able to do away from home, but would allow me really to be away from the house as much as possible. So little did
Mhm.
I know that that complicated dynamic would ultimately propel me to become, an honor student times
Right.
five.
Right.
But no, honestly, I would describe it as very complicated.
Yeah, very complicated. And so I heard you mention it was three of you all, and you was the youngest, and your stepfather had four much older children. So you were the
Yes,
youngest of seven total.
yes.
So what about, and they had children. So were
And
you
then
older
they
than their
had two.
children?
So then they had two children, and so I moved from being the youngest out of the seven to then there were two younger children that they had together. So, and like I say, in hindsight, you understand these things, but at the time, it's just a huge sense of displacement. First I went from just having two older brothers and I'm a baby girl to now we have this other group of people that I don't really know because, I was a young kid. They're older. I can't really relate to them. And then
Mm-hmm.
without anybody asking my permission, here comes my little
Mm-hmm.
sister and my little brother. So just trying to
Mm-hmm.
just, I think back to it now, just trying to figure out as a kid, where do I fit in and how is this all
Yeah.
working together? I would say complicated, confusing, a
Mm-hmm.
lot of sense of just aloneness because not really knowing who to talk to about it or how to navigate it. No, there was definitely no conversations about, hey, we're blending the family and your
Mm-hmm.
role is important and you're not losing your space in the family. So there weren't any of those types of conversations. So, just growing up, I found things that kept me away, but
Mm-hmm.
also things that thankfully were positive and ultimately propelled me in a positive direction. But I fully recognize that that did not have to be the case. Statistically speaking, I could have just ended up in a whole different situation.
Mm-hmm. Do you think you were just lucky? Was it, did you meet someone along the way that kind of got you into books, or was that just how you were rather? You just kind of leaned into academics and sports and any extracurricular activities that were positive.
Well, to be honest, that's a good question. These are some good questions already. But to be honest, I think part of it was I grew up during a time where you couldn't be far from home. You had to be home before the street lights came on. I'm a little bit older than you, so the rules were different. So where we lived, the public library was close. And
Mm-hmm.
so, the elementary school that I went to was in walking distance. And so on the way home, so really the only place I could really tell my mother and my stepfather that I was going to be, that was going to be acceptable, was the library.
Mm-hmm.
And so through that really mechanism of trying to escape or just be invisible or out of the way, I really did just develop a love for reading. Initially, I don't even know that it was a love for reading, but it was definitely a passion or a way to read stories and books at every age that took me away from the reality that I was living.
Mm-hmm. So for some people, it's TV. And being that you had nine people, or 11 if you include the adults in the household, I'm sure if you all had TV, cable TV, everyone is not fortunate to have that growing up. But I'm quite sure, because I had a similar between siblings and cousins living in the house, uncles, aunts at times. There's not that much time to have a TV, even if you do have cable.
Right,
So you do
right.
got to find an outlet in other areas, right?
Hmm.
So,
Right. And I will also add to it in transparency another layer that, that you may have as part of this conversation or not. I also grew up in a dispensation of time where colorism was big. So my mother and myself in particular, I would have been considered the lightest one in the group. And
Okay.
so that created just that in and of itself. And so just imagine, I'm a young kid growing up. I don't have any idea or any awareness that there is an issue even among the community about the color of our skin. So
Mhm.
that within the household structure created big problems for me. There were just various reasons for me to just try to be, just not bring any negative attention, really no attention, but definitely no negative attention. So
Mhm.
it was important. And my mother would say, if she were on here right now, she says it, but she doesn't know why it was really the case. She said, "You never gave me a bit of trouble. Never."
Mhm.
And I was
Yeah.
thinking, yeah, I never wanted to, I did not want the radar to be on me for any reason. I already knew that it was a
Right, right.
problem with the color of my skin. And then I had to be, cautious about the fact, if I keep winning spelling bees and being honored for things, there's just a lot of dynamics going on
Those
among
family
the
dynamics.
yeah, those family dynamics. And so yeah, it was complicated. And your other
Mhm.
part of that question was, you said something about what were moments in life that helped shape. Didn't you ask me that? Moments in
Yes,
life?
yes. Just was it any key moments that helped shape you into the person that you became today? And it could be
Again,
childhood, it could be early adulthood.
I say in hindsight, what I'm coming to realize is I think that for all of us, whether we know it or not, along the journey from childhood up until, there are moments and things, good and bad, that
Mhm.
shape us. If we allow those things to shape us, we
Mhm.
can evolve and extract even from bad or challenging situations. How am I going to let that situation impact me, and what can I do with it? Is there something that I can do with that? So I would say there have been things in every season of life that I feel like have been moments that have helped me. I was telling my husband, in fact, we were having a little bit of a conversation yesterday, and I was telling him, I wish I could remember like the resource officers who this gentleman would have been in my elementary school. And I think it was
Mhm.
during a time that there was something very difficult going on in my life. And I don't know how he knew it or sensed it, but I remember him telling me, saying to me, I just want you to know that whether you end up in foster care, or whether you end up homeless, or even if you have to live in a telephone booth. Back then we had telephone booths. I want you to know that you have what it takes to be successful.
Mm.
And just those words imparted, you
Man,
know,
yeah.
resonated. And I wish that there was so many moons ago, but he wasn't a teacher. He would have just been like the school like resource officer. But so it was things that I heard along the way from people. I never really felt like during that time when I was having what I would consider the struggle, it was kind of that's their
Mhm.
business and you don't get into other people's business. So help was not readily available, but there were still people, adults, that would say things to me along the way that stuck with me you know
Mhm.
I wasn't hearing a lot of that at home. So even to hear those words from this person that saw me every day, I didn't know that he necessarily knew me, but for him to say, hey, no matter what, even if you have to live in a telephone booth, you have what it takes. I was in middle school.
Mhm.
So, so it's key things in hindsight that I realized, things that were said to me that stuck.
Mhm.
There were teachers and people that early on that, I did respect and just admired their kindness,
Mhm.
their just being able to see. They were passionate about what they were doing. They were not just at that time, just they didn't seemingly they were not just there to teach. So I think I was always impacted by and sensitive to people that I saw as professionals or as adults, um, giving of themselves in a very sacrificial way, even though they were working.
Okay, yeah, and I always say that the impact that we have on kids, whether they're our own children or, with me in the field of youth development, it's important for us to pour positive energy into them, pour positive love into them. That's important because it can make a difference. And I do want to touch on that later on. I will ask, so it sounds like mental health wasn't really a part of your family. Correct me if I'm wrong. Growing
Well,
up,
you in terms of was it discussed?
was it discussed? Because mental health, people have been battling mental health for years, right? But was it discussed? Was
So
anyone going to
no, so
therapy?
no, so there was not any discussions. Um, or what I would consider discussions. Being a mental health provider now, and in hindsight, I now realize that certain remarks that I would hear about such and such, into the loony bin or just things. But at that time, so there was never anything positive that I
Around it?
heard or knew that was associated with mental health at all. There certainly wasn't any like conversations of just even checking in among each other, like, hey, it's 11 of us here, how are you doing? How was your day? Just things like that. So no, mental health was, and I don't. Not only was it not talked about in my household, I don't recall just any of my friends or just people. There was a school guidance counselor, but
Uh-huh.
from what I can recall, even that was kind of like taboo or kind of, it was
Uh-huh.
real, during that time, it was really something if you talked to the guidance counselor. I mean, it was real, hush hush, everything was um very secretive. And as a
Uh-huh.
kid, I'm just still like trying to figure out. I don't really know why it's secretive or, and so
Uh-huh.
just not really knowing what is okay to talk about. I think even now when you talk about, I feel like it's important even with you serving kids, creating an atmosphere where it's a safe place for kids to be able to talk about how they're feeling or what's going on, because
Uh-huh.
they don't know until they're older,
Uh-huh.
what's okay and what's not. So they're just trying
Right,
to
right,
navigate that and need people that are willing to listen to help them to know if that's a real problem or if that's just something, that
right,
we can talk through, or you're having a bad day versus no, you really may be struggling with some depression.
right, right. And so it wasn't discussed in your household growing up or even in any of your close circles, and even for me growing up. And like you said, I'm a little younger than you. It wasn't discussed in my household growing up. None of my friends or their family was discussing it. So with that being said, how did you, come to be a mental health provider?
Well,
Was it an
actually,
exact moment? Was it a series of things that happened? Because it's been times when I was in physical therapy for my knee when I had surgery some years ago. I remember a couple of the physical therapists had injuries themselves and went through physical therapy, and that's kind of what made them want to be in the field of physical therapy.
mhm.
Same thing in youth development. A lot of people that are in youth development were bad kids when they were younger, right? So was it a certain moment? Was it a series of things that happened when you went to college? Did you learn more about it?
Well, I don't think that I walked into college or grew up just thinking, okay, I want to do mental health in particular. I just
Uh-huh.
knew that I wanted to be an individual that was a safe place, and that I was somebody that I was helping people in some capacity. I didn't know whether that was a school teacher or medical provider, but I just knew that I wanted to give back. So
Okay.
actually, for me, I started out in health as a nurse, a surgical nurse, and um, I worked in particular on a surgical unit for a period of time where people were getting amputations, and it just dawned on me at some point in time that we're coming into the room because back then the nurse comes in with the doctor. We're telling you what the procedure is going to be. Need you to sign these consents. You just, have inundated this individual and their family with devastating news. And then that was it. We'll see you in the morning. We'll roll you down. I'll see you in the OR. But there was, at some point, I realized that, okay, the mental aspect of what we're talking about here is probably more important than the amputation that's about to take place, because we
Mhm.
realized even through research during that time, even for individuals that were experiencing phantom pain, meaning the limb is gone but they were still feeling
I can still
pain.
feel it.
And yeah, and so we realized, we as a medical community realized that if we didn't address even phantom pain, people's hospital stays were longer. They, were becoming more susceptible to secondary infections and things of that nature. So I think that it was through that I kind of realized that, okay, my thing that is my passion is helping to support people from the mental health standpoint to deal with whatever, whether it's you're losing a baby, you're about to lose your leg, you just found out
Mhm.
you had cancer, or you didn't get a student loan, just whatever the things are. And so that was the segue for me, where I knew I went from I want to help people to it actually coming together that, okay, this is the way that I want to help people. And I still feel that way right now, that all of us are only as good as our mental health allows us to be. You could be educated, you could be getting
Mhm.
paid good, you could have lots of responsibilities, but if you're struggling internally, you're really not being the best version of yourself.
Mhm.
If you're struggling, with your mental, uh, you can't be the best version of yourself. And so I think that I don't remember the number exactly, but statistically, many, like our healthcare costs in America, a lot
Mhm.
of it is really mental health stuff, but it's easier for people to go to primary care and just complain about physical things. And then, an astute clinician will finally say, okay, I want to send you to see the mental health provider. But we're thousands and thousands of dollars into it before that happens. So,
Mhm.
mental health and not addressing it impacts the world economically, because people miss work, because they're struggling with depression. They don't want to say that, so they're just
Mhm.
utilizing sick days
Mhm. Yeah,
and just
utilizing sick days, it's affecting their quality of life. It's like I literally just can't go outside today. My mind, my emotions, it won't let me do it. I didn't even think about that, how it could affect the economy.
it does. I mean, if you look on at some of the data from the World Health Organization, it's jarring when you look at the numbers and the percentages of individuals that, by way of their primary care, have had a complete workup to find out that, okay, this is really a mental health issue. And then, yeah, the time missed from work and the time missed from family, so that mental health component, when we're not able to show up, whether it's physically for work or for class, or show up emotionally just for the people in our lives, there's an impact that is
Mhm.
happening that we really need to get a handle on, or at
Mhm.
least acknowledge it. So, this platform and these types of conversations, I don't think we can have enough of them.
Yeah, I agree. I agree. And it's funny because mental health, we're we're becoming more aware of mental health and its pros and cons to that. And one of the cons is that people believe that some people are utilizing mental health as a crutch. So I'm calling out today, I need a mental health day because I'm depressed. You got some people that say, there go you using mental health again as a crutch. And I do believe some of that happens, but I also believe that we shouldn't be focusing on that as much when it really is people out here that are suffering internally. But that is one of the trade-offs to us being more aware is there are some people out there that utilize it as a crutch. But what do you think about that and people that tend to focus on using it as an excuse for what they believe?
What do I think about individuals that are taking advantage of the fact that we are trying to become more sensitive to mental health and they are abusing the system?
Yeah, and I personally don't think it happens as often as people think.
Well, I was say I don't think that that happens as often as people think. I think that, just like with anything, whether it's FEMA or any other program or any entity, there are going to be people that are seeking opportunities to take advantage. I mean, without
Mhm,
fail. But I personally think, especially since there's a lot of shame and embarrassment, unfortunately, still around mental health, I think that
mhm,
we should err on the side of if somebody is willing enough to even allude to the fact that they're struggling, I need to take a mental health day, even just something like that that sounds maybe kind of benign for most people to even say that, if a patient tells me they took 2 mental health days, we almost need to have an appointment because I know we minimize. So that really means no, you're
mhm,
struggling with depression, and as that's as comfortable as you can feel saying it, to your to
mhm,
your colleagues or to your supervisor, because there is a lot of judgment and minimizing around it. And people hear it all the time. Just, even when I, as a clinician, am recommending and needing a person to take FMLA because I need for you to attend this program that I feel is medically necessary. You
mhm,
have the benefit, no, I can't do that. They're going to be so upset. They're not going to believe that, that I have mental health issues. So there's this whole other thing that goes on that it wouldn't be going on when you had your knee injury or whatever. I mean, because we could see that. So we know you broke your
mm,
leg or whatever the injury may have been. And so we can see that so we can validate that. And I think
mhm,
that we need to find some ways whereby which we can take people at their word. We can take people at their word. If you say you need a mental health day, no, we not no questions asked. I mean, we're not even going to be,
yeah,
asking a lot about that. I mean, we're going to respect that if it's happening consistently. I think people in leadership, without crossing boundaries and violating people's HIPAA, but respectfully just checking to see. And there are some companies that, and a lot of them that have moved towards having not just EPA, but also having programs and things more readily available so that people, their employees can see somebody um 11 times, or so I
mhm,
feel like some of those things are becoming more available,
mhm,
but just simply not enough. And there's still so much stigma that even for people that have it available, they're afraid to use it. They're
mhm,
afraid of what the repercussions may be, or how will I be perceived by my superiors and my coworkers if I need to
mhm.
be out and they find out that I'm out because I was struggling with a mental health issue.
Yeah, and that's very true. I've been on my mental health journey, like I said, for about 8 years. And what started mine was my anxiety. My anxiety, I started having panic attacks to the point to where it was affecting my quality of life. And my anxiety got worse when I was driving, right? So it got to a point to where I was nervous when I'm driving. I'm taking long ways to work, and I'm afraid to go to certain places because now I don't know what to expect when I'm driving. And that's what started my mental health journey. And it was very difficult to talk about. And I always say when I first started going, it was only a handful of people that knew. My mother, God rest her soul, my aunt, and a few friends, right? Few close friends at that. It took me a while to open up. I didn't want to talk about it because I felt ashamed. And after a while, after, a few years and getting more comfortable in my own skin, I did become more open to talk about it.
Mhm.
But like you said, it's still stigmatized, and yeah, I don't know if people want to take the risk of using it as a crutch as much when they know how they can be
Right,
perceived and judged
right.
still.
Right. And then the thing about it, if you think back to even when your journey started, and most people, depending on what your history is or what you've been around, oftentimes these symptoms, these things are happening, and it's hard to talk about because you don't even know how to describe it. I mean, for people that want to tell somebody, they're like, I don't even know how to even express this or explain it in a way that it doesn't
Hmm.
already just sound like I'm being ridiculous when I'm saying that I literally know that I need to drive over this bridge for work because my
Hmm.
customer is there. There's no way around it. And I'm having to literally miss making that sale sometime because I cannot drive over a bridge that I have driven over 150.
It and it don't make sense to the average person, right? And I have a team member that I work closely with, without, and I'm not gonna give her name, but she has a phobia of bugs, right? And that's something, once she told me a little bit about her story and some of the situations and some of the encounters that she's had with bugs, I'm like, man, I can see how you have a phobia with bugs. But when we went to a conference out of town, and it's funny, it was last year, the cicadas came. And me, I have my anxiety when I'm driving, so it's like, hey, if you don't mind driving, I will keep you safe from every bug, every cicada that we may encounter, right? And thank God for her, because she's very aware of mental health and she's a mental health advocate as well. But yeah, our phobias, our mental health struggles do not make sense to you, but they do make sense, to me internally.
And whether they make
But yeah,
sense to the person internally or not, the feelings and the intensity of the distress is real.
yeah.
Whether that's depression, whether that's anxiety, for the individuals that are unfortunately experiencing auditory and visual hallucinations, those symptoms and what they are experiencing is real to them and
Mhm.
it's happening, and trying to just discount it, and that there's no benefit in that.
Yeah, definitely. And this was my thought. Kind of like teachers. When you're younger, you think teachers have it all together, and it's and when you get older and you see a teacher at a bar or something, you like, oh man, I didn't even think they lived like that, or whatever the case may be. So, and I know I had this thought as well. When you see a mental health provider, you think that they have it all figured out, right? They do this for a living. So I know their life is perfect. I do want to ask, relating to that, what do you think is the biggest misconception about being a mental health provider?
What you just stated, that is,
Yeah,
I
that
think
we
that
haven't
that
figured out.
is okay. Well, I think that there's a misconception. Well, they do this for a living. They understand what's going on. So if it comes up, whatever that may be, they know how to handle it. They're going to take care of it, which that's just not the case. It's different when things are happening to you versus when you are helping, clients and friends and people journey through it. That is a misconception. I think another huge misconception, friends and family members and people just think that mental health people, like, you have an endless reserve of, yeah, I'm just on all day every day wanting
Mhm.
to, you know get off, leave the office, and then see, what's going on and need to check in with everybody else. So I think that sometimes there's just a misconception or just an unrealistic expectation. People, and that doesn't just happen with mental health providers. I hear it from my friends that are primary care and just whatever their specialty is. It's just one of you and then 10 friends, and everybody has this one question. I want to just ask you this. My tooth in the back, and just
Yeah,
trying to
yeah.
find out. And so, but that is a huge misconception. I think, and I encourage my colleagues, we meet monthly, and, I think that our mental health providers should be taking part in some mental health treatment of some sort, even if it's just, talk therapy.
Mhm.
I just think it's just vitally important to have not just your colleagues that you clinically meet with, but just your person that you professionally can just talk to about just your own personal stuff, and then just
Mhm.
also what you carry and what you feel, or just to make sure that you are not carrying just too much of
Yeah.
what is going on with your clients. In mental health, and it depends on what you're doing. Of course, when I worked, because right now I work in private practice.
Mhm.
So the relationships that I have, they're long lasting relationships, 15
Mhm.
years. I mean, I have some generations of families and everything. So those are real relationships. So professional or not, you grow to care about these people deeply. So when things are happening to them, not even just from a mental health standpoint, I mean, you care about them, and so you carry
Mhm.
that when they're losing loved ones and things are happening. And so, as a human being, you still are impacted by it. Just because you have a professional code of ethics, it doesn't mean that it's not breaking your heart that somebody
Mhm.
that you care about is experiencing
Right.
something that's devastating.
Yeah, and I can only imagine. And I'm obviously not a mental health provider, but I've always been that go-to person for friends and some family. And now with some of my team members at work, and it's draining, right? So you as a mental health provider, you have your patients on top of family and friends and some of your colleagues. How do you ensure that you don't drain your emotional battery all the way to it's until it's empty?
Well, let me be transparent about that. And it's different for everybody. But for me, I don't set out the day with the mindset of, I want to make sure that I reserve some of my battery, today.
Mhm.
I don't want to set myself up for that. So for me,
Right.
that comes with the terrain, because I don't know what I'm gonna be facing until it happens. Some days, some weeks, the battery is going to be completely drained and depleted. For me, it's just more important for me to know, how do I recharge it? Sometimes it's going to be completely on E. How do I recharge it? So,
Mhm.
if that makes sense,
Yeah, yeah, it's how you recharge. Yeah.
just the recharge. I mean, I know without fail throughout the holiday season, I'm not even just setting myself up for, 'tis the season to be jolly. I'm about to be going out and no, this is a time when I know people are struggling. I'm going to be available. So I may be drained, and it's
Mm.
okay as long as I know, and I'm going to be intentional about the recharge.
So the holiday season is a time, and I didn't mean to cut you off, forgive me. Holiday season, around the holiday seasons, whether it's Thanksgiving, Christmas, I'm sure Mother's Day, Father's Day. So is that a time when your patients, the frequency of your patients
Yeah, the
increase?
frequency and the intensity of what's going on. And that makes sense. And so, as a clinician in private practice, meaning I know those individuals are going to be relying on me, I try to avail myself. Those are the times that I'm available. Off season, and like I said, I have relationships, with my patients, so they know when I
Mm-hmm.
am disconnected. I mean, I'm recharging all the way, because I want to be present and be able to give people 100%. Now, I will say this. This is what I was going to say. At the end of a day, I try to do a really good job from the time I see my last patient and wrap up or whatever, to see where
Mm-hmm.
I am, so that I can be honest with, my husband and my kids about where I am in a loving way. Like,
Mm-hmm.
the cup is running over, or,
Mm-hmm.
I got a little sign on the door that just unavailable, and so they know now and they're sensitive to that. And so I think that that's important for not just mental health providers, but even people in your line of work, being able to
Mm-hmm.
check in with yourself at the end of the day to see if you have anything left in you for your friends and family members. I like to take the approach where they know, okay, I want to be able to give you, it's about the quality of the encounter or whatever. So let me recharge, let me make sure I'm in that brain space so that when we have the conversation, I'm not just half heartedly present. And I think people respect that more, and it it just it works for me.
Yeah, I think that is very important to check in with yourself and also be honest with your loved ones rather than going home on empty, not communicating that. And now you lashing out at your significant other, at your
Hmm.
kids, and it's like, what did we do?
Right.
Right. But I think a little bit of that communication and that just that self check,
Hmm.
doing a self check with yourself, it goes a long way. And that's something, and we'll talk about relationships a little bit here in a minute, but I think that's something as it pertains to relationships that's very critical.
Hmm.
I do want to discuss a few things that I'm passionate about. And the reason I want to discuss these things, is what I've been feeling for a while. It's just when I was younger, I didn't really have the words, the knowledge, enough experience to really articulate it, right? Or to
Hmm.
even ask the right questions. So when I was younger, and my friend, and I wish he could have made it, but my friend Derek and I, we were a part of a after school youth program when we were teenagers, right? And I believe now that I'm older, I understand the grant language and stuff. So the organization received a grant to purchase video equipment. So we had a few nice cameras and everything. And of course, to fulfill that grant, we had to develop a video project. So
Hmm.
we decided, or we were voluntold to do a documentary about the violence and the drugs in our community.
Hmm.
So roughly it was about 15 to 20 of us, right? And I oftentimes go back to that documentary and I look at how innocent we were. And all of us had high hopes and dreams about our future. In fact, at the end, one of the taglines was, "I'm taking a stand. Next time you hear about my hood, it's gonna be something good." Kind of like that, right?
Yeah.
And I look at how young we were, and how innocent and everyone was. Fast forward over the years, some of us have passed on, have died, been murdered. Of course, there are some that are incarcerated. And then there are just some that are really just struggling through life. And I look at Derek and myself, and I guess I'm battling a little bit of survivor's guilt,
Guilt. Hmm.
right? But I often found myself arguing with individuals, with individuals that isn't from an environment like ours, right?
Hmm. Hmm.
We came from an environment that the adults in the neighborhood were selling drugs.
Hmm.
They were in gangs. It was teenage pregnancy or whatever the case may be. So that's what we had to look up to. But a lot of people that I would often debate with would say, at the end of the day, they have a choice. They made that choice and they have to live with that choice. And that is true. But I would argue that, there where we are from, our concept of what's right and wrong is different from where someone else may be from.
Hmm.
Right. And I did just want to discuss the impact our environment can have on us, just from a mental perspective. Like you said, you had adults that poured positivity into you, right? On the other hand, we had some, and I'm grateful for the mentors that I had. But once again, we had a lot of individuals pouring negative habits into our lives and negative beliefs. So I just wanted to ask you about that. Is that a real thing? The impact an adult can have on a child, the impact of your environment that it can have on
Absolutely.
you.
Absolutely. And people, I don't know them and know what their stance would be to argue otherwise. But, my husband often says, more is caught than taught. Meaning, like in these environments that children are in, you can be telling them, don't do this, don't be smoking, don't be, drinking, don't be selling. But if they're seeing it, they're still impacted. The physical and emotional abuse. So I don't know I don't, you can't separate that, Now, do you have to become a product of your environment? No, you
Mm-hmm.
don't have to become a product of your environment. But statistically speaking, the majority of people do because, I mean, that's just what especially in your formative years. You're learning how to survive and you're learning how to live. So if somebody has taught you how to cook a certain way, until you
Mm-hmm.
learn something differently,
Right, right.
whether that's a dangerous way that you're cooking or not, I mean, until you learn something different, until you get exposed to something different, you just know what you know. You just see what you see. So I think that's why the work that you do and your organization and the people that you're pouring into is so vitally important because your program may be one of the very few places that young, impressionable children are getting to see something different so that they at least have maybe a thought of something to compare it to or something that they can aspire to be or to do differently.
Mm-hmm.
But for the many, many, many individuals that didn't have those opportunities and all they see is physical and emotional abuse and drug and substance abuse and unhealthy conflict resolution, it impacts them deeply. And I can say that just, the many of the adults and young adults that I'm working with, aside from just things that are chemical in nature or just, biological predisposition to certain things, the other group of people, the crux of what we're working through would be these things that have impacted them in a negative way. The body does
Mm-hmm.
keep the score.
Yeah, the body does keep the
The
score.
body does keep the score, but we can do the work that is needed to change that scoreboard.
Mm-hmm.
You know,
Mm-hmm.
it
Yeah, definitely.
we can do the work. Um y- you know, you know, I worked in the prison system for a long time and I enjoyed that work. I really did enjoy that. But the thing that was so heartbreaking to me was that many of those individuals are in there either because they had mental illness that was just untreated, undiagnosed, unnoticed in the first place, or they were in environments where they were set up for incarceration just by the fact that nobody was teaching them a skill other than something that was illegal. And we're talking
Uh-huh.
about kids and so yes,
Mm-hmm.
the environment that our kids are in and around, we all as adults um, could take heed and really think about what we're saying, what we're doing, what we're modeling, what behaviors,
Mm-hmm.
and even being transparent and sharing our experiences. I said, not judging books by the cover. It's a lot of people, and I know some of them that have made it up and out and are in a good position, but are quick to just want to act like they don't recall that, they don't want to talk about that part or share that like there's some shame or embarrassment. And even when
Yeah.
really that might be the very thing that could help another young person
Mm-hmm.
to change the trajectory of their life.
Yeah, and people, and I'm definitely not that person, right? Because it's for a few reasons. I know that all it takes is one simple mistake, and I can be right where I can be right on the other side of
Right,
poverty,
right.
right? All it takes is one mistake, and I'm incarcerated. So I'm definitely not that type of person. But also, yeah, a lot of times people try to use me as an example. And I really don't like when people, do that. Like, well, you made it out, you turned out well. And it's like, I'm the exception, I'm not the rule. Right. And I don't believe there's anything special about me. I believe a lot of things played a part in the person I became today. I thank God for the loving family I had. And although my family couldn't teach me things like how to maneuver through college, right? How to be in leadership, how to be a white collar worker, if you will. They still poured that love into me.
Hmm. Hmm.
Right. Now, the other things I had to learn later on. But yeah, I really don't like when exactly that, when people make it out and now they're looking down on, the people
Hmm.
that's from our old environment, and but also people that try to use us that's made it out as the rule. You know what
Right.
I
And
mean?
I,
Because
I
it's
I
a
feel
much
the
bigger
I feel
issue.
the exact same way because, yes, the choices that we make um play a part in that. But depending on what your circumstances are, making some of those choices and making a right choice when you need food, when you're trying to just survive the basic
Yeah,
necessities.
yeah,
So yeah, I mean, we have to look at, statistically, when kids or young people are exposed to these types of things, what percentage of them matriculate and come out on the other side in
right.
college versus what percentage of them end up with teen pregnancy and this other, and I've heard that sometimes before, and I get where you're coming from. I don't particularly like it because to me it discounts or it diminishes the importance of, no, we really need to be trying to make as many changes as we can so that
Hmm.
the cycle changes.
Right. Right. And if I'm 1 out of 10, that's 10%. That's a failing grade, right? Any way you look at it, that's a failing grade. That's 10%. You wouldn't, get on a plane if it was only a 10% chance
Right,
that you was
right,
gonna make it to your
exactly,
destination. Right.
exactly,
So if you want to point to me, that's fine, but it's still a bigger issue here that needs to be addressed.
right.
But I really did want to talk. I'm sorry, go ahead.
I'm saying that issue is like, yeah, what can we collectively do to change those odds so it's not 1 out of 10 that's making it, it's 9 out of 10. Like, what, I feel like sometimes as a community, um, we, we talk or act as if we're powerless and and we're not. I mean,
Hmm.
we're not. There are some things that can be and should be done to make some changes, and they just for whatever reasons have not happened on the scale that they need to.
Yeah, and that's really why I wanted to, I love doing this podcast, but that's really why I wanted to have you on and other success stories and other individuals that can provide information to individuals that are, from my community, because I do think it's the lack of knowledge, it's the lack of
Mhm.
information, it's the lack of resources. And although I'm only one person, well, my friend Derek and I are only two people, we really want to just show people the way and show them that, hey, we are no different from you.
Mhm.
Where we're at right now, you can very much so achieve the level of success that we've achieved in your own right.
Right.
We're not
Right.
special by any means, right?
Mhm. And
Yeah.
I love that. And so it's not about, how many people, your circle of influence, and we don't know. I mean, I don't know with the podcast whether it's going to be one person that tells another 10 people or it could be thousands. I mean, this, just the fact that you care enough about the situation to devote your time to it, it
Mm-hmm.
says something. And that's where I try to talk to even my own kids about finding that thing that bothers you or pulls at you enough that you want to be an agent of change. If you're trying to, tapping into those things where you see something, it could be different, what can you do even if you feel like it's on a small scale? Let's do
Mm-hmm.
something. Sometimes
Mm-hmm.
it's too much of the doing nothing because we don't feel like we can do it all. So if everybody can do a little bit, we could cover some ground.
Right. Right. Okay, real quick, because like I said, I wanted to bring this and discuss mental health openly with a mental health professional,
Hmm.
and reach as many people as possible. And of course, we got to dispel some myths, that's believed about mental health in the Black community. Really quick, before we get into that, you mentioned the body keeps the score,
Hmm.
right? And I really want people to understand that because that's something that kind of helped me when I got a little anxious and a little sad last month. All right. So I was out of town with my lady, which and I remember it was a day that we was out of town. I got anxious and I was kind of sad or whatever. And then I think it was a Facebook memory or something, and it hit me. And I know this date, but I guess because we was out of town, I wasn't thinking about it. But this was the day. This was around the time that my mother passed a few years ago. And my lady, thank God for her because, she's a mental health provider as well. She's a
Hmm.
therapist. And she was kind of looking at me like, hey, are you good? Are you okay? And, she was asking me. And then it hit me. And once I said it, she was like, yeah, I knew I had it in my calendar,
Hmm.
the date. And that's why I kept checking on you because, the body does keep the score. So the body does keep the score. So for anyone that they look up and they're all of a sudden anxious, or all of a sudden they're just sad and they don't know why. It could be their body remembering a traumatic event, losing a
Hmm.
loved one, or whatever the case may be, and they don't even know it.
That's right. That's absolutely right. Not only does the body keep the score, we have to keep in mind, our brain is like a database. So all the trillions of events that happen to us, they are in there somewhere, compartmentalized. And so there may be different dates, different locations, songs. And, so sometimes people are like, I was in the elevator and all of a sudden I started feeling this rush of emotions, didn't know why. And, sometimes we can figure out what it was about, sometimes we can't. But it could have been the fragrance of cologne or perfume that somebody had on that was a reminder or a trigger of something that happened many, many years ago.
Right, right. And it don't register at the time, and it may not register at all if you're not mindful. But I really did want people to understand and know that, and in a way, not to panic or not to be too hard on yourself if you're going through a tough time.
Right. And
You know,
even if you don't know, like even on that day and you were feeling a certain way, even if you had not figured out or made the connection, even with you and your girlfriend about what it was about, just being okay, resting, in I feel uncomfortable, I feel uneasy. I, it's okay. I'm not gonna panic. I'm gonna rest in it, or I'm gonna do something to divert my attention in a way, recognizing that it's there. So, but let me see what other things I can do to get some of those emotions out, whether it's journaling, running, whatever your things are. Because we may not always know where the flood of emotions are coming from or the physical nature of some of the stuff. Because the body keeps the score emotionally, you can feel it. And sometimes physically, you can begin to feel the adrenaline or the
hmm
some of the things that come with anxiety and
right,
depression.
right, right. Yeah, definitely. I really wanted to bring attention to that. And of course, the purpose of this conversation is to make people aware and maybe even encourage them to seek mental health treatment if they feel like they could benefit from it. But of
Hmm.
course, again, before we do that, we kind of gotta dispel some of the myths or whatever, right?
Hmm.
So I'm gonna just go through them quick and you can answer. We don't have to spend too much time on them. But one of them is, does going to therapy or taking psychiatric medications mean you're crazy?
Absolutely not. And just even the terminologies when I talk about, when I was younger, you talk mental health, those type of words, crazy, loony bin, person flew over the coop. It's those types of words with negative connotations that at this point, we ought to just know better and do better. So no, going to therapy or taking psychiatric medication doesn't mean that. It means that you recognize, or somebody has helped you to recognize that you have a treatable medical condition, because
Mm,
mental health issues, just like diabetes and high blood pressure and all of
mhm,
these are sundry of medical conditions, mental health conditions are treatable medical conditions. The brain is an organ that can malfunction, just like the kidneys, the heart, and any other organ. And I think if we could just impress upon our circle of influence that why would we feel like nothing can happen to the brain at any time? So no, that is a myth, and that needs to be dispelled. Going to therapy to talk about it or to take some medication in no way means that you are crazy, or it just doesn't mean that.
okay, okay, thank you. Okay, my next one is self-medication, and I'm not talking about healthy coping skills like journaling or working out or going for a walk. I'm talking self-medication like alcohol, drugs, or other, ways that may be unhealthy. Are those healthy ways to cope? We can
No.
really focus on
No,
alcohol and drugs.
those are unhealthy coping strategies, and it could be from substance abuse. Sometimes it could be sex. It could be gambling.
Mhm,
It's a lot of different things. It could be overeating. It's those things that people unknowingly are doing because they're trying to alter their mood. At the crux
mhm,
of that is oftentimes people are trying to alter their mood, tap into some dopamine receptors, and you get some endorphins
mhm,
going. So, no, those
mhm.
are unhealthy coping strategies that generally make whatever situation that's going on worse.
Okay. I want to clarify because when I say drugs, I mean recreational drugs that are not prescribed to you
Yes.
by a provider. Like, I wanted to
Yes.
make sure I cleared that up. Okay. This is something I actually thought before that made me a little hesitant to go to therapy. I don't know why I thought this. I may have seen it on a TV show or something. But are your psychiatric records available to a potential employer or a school?
No. Psychiatric records, just like other medical records, are protected by HIPAA laws. And I would dare say, I don't know, everybody's practice is different, but even with court subpoenas and just different things. There's even extra layers of things that I do. It is highly unlikely that anybody, let me see, as of now, I don't know of anybody other than the disabilities office, somebody applying for disability, that they've gotten some records from me. And oftentimes I condense that into like a treatment summary. But no, potential employers, current employers, schools, they do not have access to your full medical records. I would want to say that there are times for certain jobs or certain things that you might have to be mentally cleared or have a clearance letter, like for my patients that are getting their pilot's license, people going to the military, people applying for the police academy. So there are things, and that's not to say that you got to be without a diagnosis, because of course if you're seeing me, more likely than not you do have something. But the real issue is us ensuring that those things are being addressed appropriately, so that that people can adequately perform. So there are
Okay.
times, but there would never be a time without your knowledge ahead of time. There should not be that anything is being disclosed, even with family members. Even
Mhm,
with family members, your medical information, including mental health,
mhm,
is private. Let me also add this. The only time that I'm aware of, like consistently, that doesn't apply is if somebody calls in and they are suicidal or they're homicidal. against somebody, and we name that we do have a duty to warn and a duty to, but so for saving somebody's life,
Uh-huh.
then, but we're not sharing the record. We may just be sharing information about this, situation.
This situation. Okay, okay. And I joke with my friend because that was a fear of his about starting therapy. I tell him that it's probably a lot of therapists and mental health providers in town. They got a group text about me that discuss, how thrown off I am, right? I'm just joking. But seriously, are psychiatric providers allowed to discuss your information with anyone, family or friend?
No, absolutely not. Now, if
Yes.
you come in as a patient and you want to bring a family member in with you, and I encourage that. Like if people, it's a team effort because we're trying to work together for the good of the person. But with my patients, I like to talk in advance about, even with the person coming, what are the parameters? What things do we want to talk about? Not that there's anything secretive, but some things are relevant, and then some things are just personal. And so no, there's no sharing with family, friends, colleagues, and or any of that.
You can't discuss it with anyone that you're close to, not even your husband, right?
No, not at all. In fact, even when we have clinical supervision, meaning it's a group of clinicians and we meet once a month, we're going to meet this Friday. If we have a difficult case, we're presenting it because we want to get some feedback, and we give initials. I mean, we don't give any demographics intentionally. So if you're not able to really even couldn't even figure out, we don't even want to take a chance on that being some, say, describe something that somebody may be able to even, I think I might know that person. So even
Right.
among the clinical team where we're all bound by confidentiality anyway, it's still done in a very tasteful, tactful way, and for the
Uh-huh.
purpose of talking through like a complicated case and getting some input from other professionals.
Okay. Okay. Thank you. Thank you so much for clearing that up and dispelling some of those myths. And so, what I also wanted to do, and this kind of came probably, I can't remember if it was right before I asked you or after I think it was right before I asked you because I had the idea of wanting to have you on. And it was like right after that, I thought it would be good to kind of post an anonymous survey for anyone that was curious about anything involving mental health. And before we get into any of these questions, we do want to give a disclaimer. Anything that we discuss on this podcast, anything that we're about to address with these survey questions, it is not for you to diagnose yourself. It is not for you to try to diagnose a loved one or anything. If you feel like you're experiencing any symptoms surrounding mental health, you should seek treatment. And please, and I'm new with this language, so please add on if you want to add on to anything.
No, you said it well, and it applies not just to the part that you're about to segue into, but just this whole platform. We want to put a disclaimer to say that in no way are we given individual medical advice. We are talking about the broader topic in hopes that people can find it informative. But by all means, if there's any additional questions or anything that people want to know, this is not in lieu of people getting individual treatment. Like, you're
Mhm.
not hosting. When we talked about it, I was clear on the fact from you that you're not hosting this at it with the intention of it being therapeutic or diagnostic in nature. This is informative, and
Yeah, definitely want to make that clear, and it's not to be used to weaponize against anyone either.
absolutely,
Sometimes I've seen people, someone may take this information and be like, see, I told you, you dealing with all of these symptoms that they're talking about on here or whatever. So it shouldn't be used, you shouldn't weaponize it to, punch down on someone, if you will.
absolutely.
Right. So, all right. So it's just a few questions. All right. So one of our listeners wanted to know, How important do you believe it is for a Black person to have a Black therapist, and how important is it for a male to have a male therapist or a woman to have a woman therapist?
I think that those factors are only as important as it is to the individual,
Okay.
if that makes sense. You know,
Mhm.
if an individual, because it's about comfort, it's about your comfort level and who do you feel like you can relate to with whatever the subject matter is. I definitely, I'm a Black person. I definitely see more white people than I see Black,
Okay.
but I see nationalities. I have, Hispanics, Middle East. I mean, so I do know sometimes, I do have individuals that are asking me for referrals sometimes for therapists specifically based on race or sex. And I think that that's perfectly fine. Sometimes people have some good, for individuals that perhaps, for instance, have had some sexual trauma. It makes sense
Mhm.
to me why they would like to have um, a female version and that's why it's important even when people are accessing like insurance benefits, if you're looking for a
Mhm.
provider or even on Psychology Today, whatever the things that you're looking for, your preferences, most of those have on the search engine where you could put those, whether it's black, white, if you want male,
Mhm.
female, what age group, if you want somebody that is a Christian versus not. I mean, so there's a whole sundry.
LGBTQ
Yes,
members of
yes.
that community as
So
well.
and so, so I just think on that, to each its own. It's about, and people might have to go through more than one person. That's one
Mhm.
thing about therapy and mental health treatment in general that I think can be discouraging. Sometimes people might have to try more than one medication before they find the one that works. Same thing with a therapist. But when you find one, I mean, that's a invaluable relationship when you find one that you can connect with. And I would
Mhm.
also say, depending on what the topic is, you may in your lifetime have different therapists for different reasons.
Mhm. Yeah. Yeah. No, very much so.
So for me, if you're asking me my opinion, I don't think that it's important, those factors. I think that it's important, or most important, that the individual just check in with themselves about what do they need. And even if they get with a therapist and go for a few visits, if you don't feel comfortable, if you don't feel like this is somebody that, I'm going to be able to really open up to, that's not the right person for you.
And that's okay. And that don't mean you should give up. And sometimes you're not fortunate enough to find a good mental health provider the first time around.
That's right.
And adding to that, that don't mean you should give up and say therapy isn't for me or psychiatric medications aren't for me. That just means I have to still, in a way, date around
Right.
and find a treatment that works well for you.
And I like the fact that a lot of mental health providers and therapists now, because they don't want to tie up patients' time because either. I do like that a lot will do like a brief screening, just kind of like, over the phone, just to kind of see, just initially like the issues, the topics, or those things that I really feel like, you know, I can, if somebody's dealing with OCD and OCD is not something to, and being honest about that. So I do like the fact that I see more of that happening.
Okay, yeah, definitely, definitely. One of our listeners, and again, this isn't to diagnose anyone or try to diagnose yourself, but one of our listeners did wanted us to discuss paranoid personality disorder.
Okay. Well, that's a very specific
Yeah.
so would it be okay for me just to speak more general about personality disorders just in general?
I think that would be better instead of narrowing it
Okay.
down. Let's talk
Okay.
about
So yeah,
personality
because
disorders.
there's several personality disorders, and I chuckle at it. I mean, it is important, but I do feel like personality disorders, that is probably something very common that people get. You can get browbeat over that pretty quickly when people throwing around. People either have multiple personalities, paranoid or narcissism. And so, personality, when we're talking about personality disorders, we're talking about complex combination of traits that make it difficult for people to relate to others, just what we would consider the norm.
Mhm.
So with a paranoid personality disorder, since that's the one you're talking, it would be hard for me if I'm struggling with paranoia, if that's a trait that innately as a part of my mental condition, it would make it very hard for me to develop healthy relationships, whether that be with my spouse, just the world around me, because there's some
Mhm.
paranoia there. And when people have, for instance, a borderline personality disorder, those people have struggles forming solid relationships because there's this love and hate, there's some volatility. So when we're talking about
Mhm.
personality disorders, we're talking about mental health conditions, but they're rooted in traits and attributes and symptoms that make creating and sustaining relationships difficult.
Okay. And like you said, you chuckled when I first mentioned it, and it's because a lot of times people love. And this person, I don't know who this person is. Again, it's completely anonymous. So I don't know if they've been diagnosed with it themselves or they think they may have it. But a lot of times people like to throw around personality disorders,
Right, in
right? So
general.
I think you may have paranoid personality disorder. I think you may have bipolar disorder or
Right.
whatever the case may
And I
be.
will say, even as a clinician that's been evaluating people for years and I feel pretty comfortable in what I do, before I diagnose somebody with a personality disorder, we've had several visits. I may sense it on the front end, but I'm generally trying to make sure that there's not any anxiety or depression or any other mood disorder or something else that may be presented in such a way that a person is having some symptoms that could be mistaken as a paranoid personality disorder. For instance, for individuals that are highly anxious, there's a thin
Mhm.
line sometimes between some anxious, panicky thoughts and feeling paranoid about something happening. So,
Mhm.
generally, I'm trying to work on the bigger issue first, reduce those symptoms, we work through those, and then see if there's some just innate, inherent personality traits there
Mhm.
that contribute to distress.
Okay. Okay. Thank you for that. So one of our listeners, and this is kind of related to mental health, but they wanted to know your thoughts on modern dating, and they really think that it's a single epidemic. So they wanted to know, do you think modern feminism or politics play a part in it? And I'm assuming it's a guy. He also asked, what are some things I'm sorry, no, this person asked, what are some things men and women can do to be accountable?
That's a big question with just a lot of parts there. So let me see how I
So
can.
first one, thoughts on modern dating.
So my thoughts on modern dating or the way that we date now, I do think it's very different. I think there are a lot of factors that make it different, from social media to the way we communicate more electronically, the way people are meeting. So I just think fundamentally, just like with other changes, the way we travel, the way we do everything else, um, the way that people meet and date and communicate, that has changed.
Mhm.
I think that I have seen some parts of it that I could see as maybe positive, in the sense that, like, when with social distancing, or with people that are highly career driven, being able to have some of these platforms where you're not isolating, you're still getting to communicate with some people in hopes of, like, seeing if you can make some connections. Whereas, with time limitations, constraints, you may not otherwise be able to meet people. So I can see and have seen that oftentimes be very, very positive. But some of it I see is negative, meaning that with modern dating and the way that a lot of it's done, it leads can lead to less accountability.
Mhm.
There's a lot of ghosting happening. There's a lot of just, people just either catfishing, or, having different agendas other than genuinely trying to meet somebody and seeing if we have a connection and if we want to forge a relationship.
Mhm.
So I think it's and I hate to say this, because that's one of the questions that I asked during assessment with new patients about their relationship status, and so frequently it's complicated. And I'm just like, that's the
Okay,
response.
so not single, not in a relationship or married. It's complicated,
It's
right?
complicated. And I'm like, what can we do to uncomplicate it? And so, yeah, yeah. So my thoughts on modern dating, um, is that, it definitely is turning into a different experience. I think that we still can find some ways to navigate it in a healthy way and still end up in healthy relationships.
Mhm.
I don't necessarily know to what degree any, that politics, and it's just in my mind that
Mhm.
politics, and I don't know if they mean politics in terms of the political arena, or
Just the politics
the
of in other areas of life,
other
right?
areas. So I'm sure to some degree, some of all of that impacts it to some degree. But the bigger question for me is, like, what are things that men and women can do to be accountable? I think that accountability, I think it's great for people to have accountability partners, because we got to, like, what are we being accountable about and to who?
Mhm.
So having some
Mhm.
accountability partners, that's good. But I think this is even m- all the more reason why checking in with ourselves and our mental health is important, because if you're not healthy for yourself, it's real challenging to form a healthy partnership relationship with somebody else. And I think that
Mhm.
that leads to a lot of singleness, or a lot of discouragement about relationships, that lead people to just say, hey, I'm just going to stay single because this is just more hassle than it's worth.
Yeah, and I'll say this. I'll just add to that really quick because I'm not shy of disclosing that I've had a few failed relationships. And I will say one of the things that changed for me was when I started to hold myself accountable and started to ask myself, okay, I've had these failed relationships. Okay, what can I do better to become a better partner? And it's constantly asking myself, oh, how can I continue to be a better partner? And now, knock on wood, I've been in a healthy relationship,
Mhm. And
right?
I
But it
think that
didn't change.
even when we're in healthy relationships, and first of all, it's amazing that, see, you're insightful enough, instead of looking at the other person and other people, at some point in time you wanted to see, like, your part. If we,
Mhm.
that's just huge, and I love that. But even when we're in healthy relationships, the some of these things have need to be ongoing, where we're checking in with each other. When I'm working with
Mhm.
couples, I encourage them to have table talk, which is 15-20 minutes a week, where they're talking at the table about what's going good in the relationship And then if there be anything that they want to work on, what would that be? So that way people don't feel ambushed. They don't feel like, oh boy, here you come again with something else. It's just kind of like
Hmm.
a relationship business meeting of sorts, just to kind of check in, because we are ever evolving and changing. And if we want our relationships to want to remain good partners for people, we got to keep the dialogue open.
Yeah, we do, and that's very important. And my lady and I, we're constantly having those checks, and we're constantly asking each other, like, "Hey, are you okay? How are you doing?"
Hmm.
Right?
Hmm.
But yeah, and asking and not being in our feelings and being open minded. Right? Okay,
Yeah,
okay. What do you need from me? Is there anything I can be doing better? And sometimes, a lot of times, it's not a pleasure to hear, but it is necessary if you want to continue to have a healthy relationship.
that's right.
Right?
That's right. It's probably a week or so ago, and I don't even know what
Hmm.
we were talking about. I totally wasn't expecting it. But my husband said, and he's like, you know, you, and he meant it. He said, you know, you're my best friend. And I was so
Yeah.
taken aback. I wasn't expecting it. I got emotional. I had to call a few people and tell them. I mean, it's just,
Just
it,
something as simple as that,
yeah,
right?
but that really felt good to know that. I mean, he feels that way, and that the friendship is at the core of the relationship. Because with a best friend, I mean, we could
And that's
talk
how it should
about,
be.
talk about things without being combative and argumentative. It's a different type of connection when it's your person, but it's also your best friend.
Yeah, and I feel the same way about my lady, so I definitely agree. Okay, one of our listeners wanted to know the percentage of mental health issues that can be passed down from parent to child, and is that number greater in African Americans?
Okay, so I don't think that there's any clinical research that has been done that actually talks about like a percentage, or because mental health is not passed down in that sense. So what we know medically is that in families there's a higher likelihood for people to have mental health issues if somebody in the family does. But it doesn't
Mm-hmm.
necessarily mean, so there's not a genetic predisposition where we've nailed down some genetics where I could predetermine that my daughter that's pregnant, that her child is going to have a mental condition, even though we did a whole complete genetic workup during this
Mm-hmm.
pregnancy. We check for all diseases, but mental health is not one that, as of right now, you can
That they
like
can.
predict from a genetic standpoint. Um, but we do know that in families, that's why, knowing our family history as best as we can better
Mm-hmm.
help us understand like what we're dealing with. We know that past two or three generations back, people have struggled with some degree of anxiety or depression or bipolar disorder, and there's something going on. We know that there's a high likelihood, but there's not a percentage. So that's
Okay,
past.
and I just wanted to add, so and that doesn't mean that if you are battling a mental illness that it will be passed down to your child. So that
Right,
doesn't mean that, right? And even if that does happen, right? That doesn't mean your child is gonna have a horrible life,
right,
right? Because there is
absolutely.
treatment
And
for it.
we have to keep in mind, like I say, I work with some families where I'm working with several people in the family. Mental health, it's a continuum. So there could be somebody that just has very mild anxiety versus somebody in the family that has some severe, like OCD. And so,
Mhm.
you know, again, our ideas about mental health, we have to reframe them, because everybody that's struggling, I'm sure some of the people that listen to this podcast, they're gonna be looking, they're gonna say, Jeremy not being truthful. I know he didn't have anxiety or panic. I mean, they
Yeah.
just couldn't even fathom that. They just wouldn't be able to fathom it. But there's not a percentage that I'm aware of that we could tell people that, hey, you're likely 25% likely that your kid is going to have a mental health. And there's nothing in the literature that would say that this happens more for African Americans than any other race. It's just
Okay.
equal opportunity versus, there are some medical conditions that African Americans get, but not with mental health.
Okay. That's good to know. Okay. And this person and now, I want to say I don't know exactly what mental health condition they're referencing, right? But they did ask for ways that they can treat their mental issue without medication. Now I know that, you don't know this person, you don't know if they have a diagnosis or not. So I guess we can keep it vague. And what are some things that you can do to improve your overall mental health?
Yeah,
Now it
let's
could
say
be
it
in
that way because I don't want to
combination.
say treat. If the
Mm-hmm.
person is thinking that they have a mental condition, I do strongly encourage people to at least get an evaluation. It's
Mm-hmm.
harmless. There's no blood to be drawn. It's really a conversation and maybe some assessments to really find out if there is a true mental issue in that sense. But let's keep it broad and just talk about, like you said, what are some things that we can do to help our overall just health, all of us, whether we have a diagnosis or not. Maintaining some boundaries and balance in
Okay.
life, setting
Okay.
some boundaries, having some degree of balance, meaning, we had some social life going, some work life balance, some being intentional about our physical health,
Okay.
exercising, journaling. And it's different for everybody. Music is a huge, it's getting your toolbox together and putting things in it that help you to feel better. I have so many more people now involved in cold plunging. I don't know if you are familiar with like the flotation sessions
Float
that
therapy.
people have, sound baths, massage,
Mhm.
that they're adult coloring.
Mhm.
The key is, yeah, I mean, checking in with yourself, finding out what are some things that help you to feel less stressed in the world around you. What are some things you can do, yeah, that help you to step out of, because I think we think on large scales that I got to go on a vacation or I got to, no, but they're just small things just throughout the day,
Mhm.
sitting at your desk, doing some deep breathing,
Mhm.
mindfulness, having good
Mhm.
sleep hygiene. That's probably one of the
Yeah.
number one things. If a significant amount of people would just work on sleep hygiene, I think that would help us just significantly. But getting
Mhm.
adequate sleep, knowing when to say no, yes, and not right now,
Okay. Yeah.
being
So
okay
that
with
yeah.
that. But I would want to say to that listener, there are lots of ways. Every person that sees me is not on medication. That doesn't have to
Mhm.
be the go-to, but just taking that first step to go and talk to somebody to see if what you're experiencing could be helped with medication, and if not, what are the things that I can try, and then circle back around to make sure if those things are not working, what can I do next?
Okay, I love that, and I love the mental health toolbox as well, because that's something that has helped me. Whether it's ensuring that I keep some headphones, whether it's having I have a, I have medication in the event of an emergency, of course, to calm me down. So knowing that I have that, and most of the time not even having to use it, but knowing that I have that, having a go-to person to call. Of course, we have the hotline to call if we're in crisis, but also having someone, a loved one, a friend, that you can call, that you can depend on and call if you are experiencing a mental health
Hmm.
crisis. That helps as well. So I
Hmm.
definitely appreciate you answering. And that's all of our survey questions. I only have two more really quick questions for you.
Okay.
All right. And I ask this to all of my guests that I have on. All right, so my first question okay, is what is your deepest fear?
My deepest fear. Oh, my deepest fear, you mean like in a deep, meaningful way of life or just.
It can be whatever way you interpret it. It can be in life, or it can be, since we're talking about mental health, it can be a phobia that you have to work through. It can be either or.
Because okay, so I want to preface it by saying, I am a person of faith, and my faith is important to me. I lean on it a lot. And so when I think of fear, I don't really like resonate or rest in fear, because
Okay.
I'm about my faith in that aspect. But I have a fear of I don't know how to swim. And so I have a fear of if it's more than a little bit of water, even though I can't drown
Mm-hmm.
in it, I have, so a phobia that I'm hoping to work on this summer is just, yeah, a fear of water, of
Okay.
large bodies of water,
Mm-hmm.
but in a more meaningful, because I think you look at something more meaningful.
Well, no, I do think that's good, and I do want to touch on this, right? Because I think your phobia is a good example to utilize, and I want to say rest in peace to Malcolm Jamal Warner, right? I really want to say rest in peace to him. He has been a huge inspiration to a lot of
Yeah,
us,
absolutely.
of generations of people, right? And unfortunately, he met his untimely demise, and
Mm,
we know the situation.
yeah.
And so I guess I'll ask this quick question. Is it healthy, for you to have this fear and this phobia, right? Because this is something I would tend to do, and it added to my phobia, that I may have. When a tragic incident like that happened, is it healthy to really look at it, continue to read up on it, see what happened and all of that? Is that a healthy way to cope with your phobia? Or is that a healthy thing to do if you have a phobia of large bodies of
Well, I
water?
just want to speak on it for myself. I mean, I knew just enough to know that, he was on vacation and he drowned. That's all I needed to know. I didn't want to know anything else about it because, I mean, it was just heartbreaking just to know he was on vacation with his family. But so I certainly it wouldn't help me to be delving in or getting any information about how many people drowned over the last year or any of those things. That wouldn't help me. I do feel like it kind of propelled me a little bit more, pushed me a little bit more to say, okay, all the more reason that you need to be able to swim. Like you might not be,
Mhm.
in Costa Rica, but you might be over here at the pool with your grandkids or whatever, or somebody, And so it propelled me in that regard. But, I that is I would say not just a fear, that is a phobia
Mhm.
of
Okay.
mine. It is a phobia and I've been vetting people and everything so that I'm not even gonna say so I can learn how to swim. I'm gonna be transparent and say so that I can even get comfortable going to the pool, walking inside, even if they just want me to get in 1 foot of water first.
Yeah. Yeah. Okay. Okay. Well, thank you for sharing that because mental health providers have phobias too,
Yeah, we do.
right?
We have fears and emotions, and yeah, for sure.
So thank you for that. Okay. Final question. What is your ultimate life goal?
My ultimate life goal. My ultimate life goal of what I would love to do ultimately while I'm living, just in this season of life with my husband who is my best friend. I would love for
Mhm.
us to be able to partner and in some meaningful, real tangible way help to really really make a difference concerning mental health and the way we look at it in our in our communities. And I don't mean just among African American people, I just mean in the church community, just communities. But I would love to be able, to partner with him and together we make a difference
Mhm.
while I'm living. And then ultimately, I would love, my life goal is to, and I mean this, is to leave a legacy for, my children and grandchildren, a legacy of just them knowing that my why my life mattered, why it mattered. Yeah, I want to leave that legacy, more so than tangible things. I want them to know and be able to say, my mother, she loved helping people.
Mhm.
She went out that last day, she saw that patient, and then, you know, her life ended.
Mhm.
Just making sure that, because I think it's important. I think about loved ones and people that I have lost, and even some of them, I'm just like, man, I really wish that I knew or could say, like, okay, what was their legacy? Like, what was their uh, thing that they were passionate? What was their thing?
Mhm.
And
Yeah.
so, my ultimate life goal is, I know what that thing is, but I would love to be able to do that thing with my husband, and
Mhm.
then have it to be something that my children's children's children could carry on, even if that meant, they're offering scholarships, or they're paying, they create a clinic, a resource where people can go and get services.
All right, sorry, we had a little technical difficulties for a minute, but I did get to hear, your ultimate life goal as well. And I really just wanted to say, I hope and believe that you will achieve that life goal along with any other goals that you set out to achieve. And I really want to thank you for joining me and to talk about mental health on
And I
my
want to thank
platform.
and I want to thank you for um having me on the platform. I genuinely want to thank you for seeing the need to discuss topics like this. And um, I encourage you to stay on your journey. More people are probably watching you than you would ever even imagine, even though it's
Thank
not
you.
about that for you, but it's impressive. And if I could ever, if there are any follow up questions or things that come up that, I don't know how you get the feedback from people, but if that be the case, do not hesitate to let me know. I'll be happy to come again, because these are topics that, the more we talk about it, the more people want to talk, get questions
Hmm.
answered. And this might be the only or the safest platform that some people have just to get some of this information. So
Hmm.
if us talking for short periods of time and answering questions, even if it's on the tail end of something else that you're doing and you just have some questions and I just jump on and answer them, I'm happy to do that anytime.
Okay, I appreciate it. And like I said, I want to do this because you were talking about mental health more, but you look up and you see a lot of people that are, famous, and I appreciate them for talking about the importance of mental health, right? But a lot of times when it's people that are famous or that have reached a certain status in life, and it don't always seem obtainable, right? I wanted to show people that you can achieve success. You can pardon me, you can achieve happiness. You can be on your journey of wellness and mental
Hmm.
wellness.
Hmm.
I wanted to show people that you can do that with the resources that you have and
That's right.
with where you're at right now. So
Hmm.
yes, I really do appreciate having you on.
Well, anytime. And I hope you have a great evening. And I'm available as a resource anytime.
All right, thank you. You
All
have a
right.
good one now.
You too.
All
Bye
right.
bye.